Come with me for a day in my life as an anesthesiologist assistant working a 13-hour shift. On this day, I was assigned to an ortho room. I was involved in 3 different anesthesia types. For the first case, which was a right total knee replacement or arthroplasty, the plan was for general anesthesia with a breathing device called an LMA. During the maintenance phase, I received a morning break by one of my coworkers. Then I dropped off my patient in the recovery area known as PACU. The second procedure was a hip replacement, and that was done with a spinal anesthetic. I had a student this day, and they had the opportunity to place a spinal under the supervision of me and the anesthesiologist. In between cases, I grabbed lunch. For my last 2 cases of the day, the procedures were relatively small and relatively quick upper extremity procedures, and so the anesthesia plan was for sedation. The patients received Versed, ketamine, fentanyl, and propofol in their IV to make them more comfortable during the procedure. In addition to that, the patients were also breathing in oxygen through their oxygen masks. As one of the later shifts, I went around to see if any of my coworkers needed to be relieved early, and it turned out that a lot of the cases were ending early that day. There isn't an anesthesia tech where I work, so I went around, restocked rooms, and then headed home. It was a nice mix of different anesthesia types and a rewarding day overall.